Welcome to Roadmap to Residency Evidence-Based Application. This is a very short video on social determinants of health. So, what are the different socioeconomic indicators? So, there is not any ideal indicator, but some options that we have are wealth. So, the income readily measurable in most societies, but only covers part of the picture. Does not apply well to elderly, to housewives. The individual of a family income and how to pay for family size are necessary. Occupation, reasonably comparable across countries, may have direct relevance to the health, exposures and hazards, difficult to classify in a school, and does not apply well to retired housewives or children. Education, may be the driving force behind the occupation and income, permanent and unaffected by market fluctuations, applies to those not in labor force, established early in life, so may not reflect subsequent changes. Composite indicators, that is, it is a blend of all of this, and the choice of weights for components is difficult. Now, for the socioeconomic determinants of health concept map, we can see that there are multiple factors that play a role in the health of the population or in the health of an individual or a family. So these may be uh, education, healthcare, social environment, the physical environment, the economic stability of the patient. The economic stability means employment or any ecological factors, the housing security and food security, physical environment, for example, crime and violence may impact the health of the patient, the resources and services that like the access to the resources and the quality of the services that the patient is receiving, the healthcare, the health literacy, and the education of the patient. So yeah, all of these play a very significant role in the health of the population. So what are the impact of different factors on risk of premature death? So this is a specific example of the impact of different factors on the health of the population. So you can see that the social and environmental factors, there is 20% impact of the social and economic factors in the health of the population. So this is a very, very important factor to determine the while making the plans and strategies for public health. So the hospital organizational factors, the other hospital characteristics, they all contribute towards the patient development, towards the patient accessing hospital care. And there may other socioeconomic factors like education, income, and Medicaid participation. So if the patient does not have the adequate education or income or adequate insurance, then the patient may not seek the care. Right. So here you can see that among all these different factors too, the socioeconomic factors play a very important role in the health of the family or an individual. Now, this is how this all works. So the family expands, the economic status and lack of education lead to the continued dietary choices. So there is poor diet in the early childhood, and there is lower academic performance throughout the school. Then, if the patient has a lower academic performance, then there will be less education, fewer of opportunities, and again, lower social status. And this will continue as a viscous cycle. So that's how you know that how the socioeconomic factors of the family, of the individual affects his whole life. Now, what are the different social determinants of health? So, economic stability like employment, income, expenses, debt, medical bills, and support. The neighborhood and physical environment like housing, transportation, safety, parks, playground, walkability, education, for example, literacy, language, early childhood education, vocational training, higher education, food, hunger, access to healthy options, community and social context systems, social integration, support systems, discrimination, healthcare systems like health coverage provider availability and quality of care. These all have very specific health outcomes like mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations in the family. Here you can see this is a data, okay, about global health disparities. I've just taken this out from the internet and this is just want to know that people over the age of 60 have made up 94% of COVID-19 deaths in the European Union. And people with disadvantaged backgrounds in Latin America and the Caribbean are 43% more likely to have a disability. And these are the data that will show you how there are different global health disparities happening all over the world. Thank you for watching. Keep studying.